Let's now look at the situation in the war-torn Gaza Strip, where more than 13,300 Gazans have lost their lives in the Israel-Hamas war to date, while hundreds more continue to perish daily. The toll of healthcare workers following Israel's onslaught also paints a grim image. Now, according to the Palestinian Health Ministry, the number of healthcare workers killed in the Gaza Strip since October 7 has reached 220. This as Israel continues to relentlessly bomb and invade Gaza hospitals. The death toll of aid workers is also mounting by the day. According to the United Nations Relief and Works Agency for Palestinian Refugees, at least 104 of its staff members have also been killed in the Gaza enclave since the conflict broke out. The case for reporters and journalists is no different either. In the latest, Bilal Jadala, one of the most respected journalists in Gaza, was killed in the relentless Israeli onslaught on the Gaza Strip. Israeli bombardment of South Lebanon earlier today killed 4 civilians. 2 of them were journalists of Lebanon's Al Mayadeen television. Al Mayadeen said its correspondent Farah Omar and cameraman Rabi Ma'amari were killed. The Israeli military said it was looking into the details of the incident. Al Mayadeen director said the 3rd civilian killed with the 2 journalists was also a contributor to the channel. Known as the godfather of Palestinian journalism, Jadala was the chairman of the Gaza Press House, established in 2014. The organization is dedicated to training the region's future journalists. Jadala's death brings the number of journalists killed since the start of the Israel campaign on October 7th to 50. These include 45 Palestinians, 4 Israelis, and 1 Lebanese journalist. Now take a look at this video released by Palestinian journalist Hassoun Aslim, outlining the many dangers being faced by Palestinian journalists on ground. Aslim was killed in an Israeli airstrike on November 19th.
مخيم البريج، المخيم الذي يكتظ بالسكان وسط المخيم. نتحدث عن استهداف الاحتلال لحي سكني كامل يتكون من عشرات المنازل. نتحدث عن عشرات الشهداء، عن عشرات المفقودين تحت الأنقاض. نتحدث عن عشرات المصابين في أزقة الشوارع والبيوت المجاورة. نتحدث الآن عن قيام المواطنين بإخراج بعض الأشخاص.
Making matters worse are the thousands of civilian casualties, which are still increasing by the hundreds daily. According to the Palestinian Health Ministry, more than 5,500 children have lost their lives in the Gaza enclave since the conflict broke out on October 7th. 3,250 women have also been killed in Gaza. The Palestinian Health Ministry in the West Bank has said not only this, 695 elderly people have reportedly been killed in Gaza. Sana Beg is the Director of Communications for MSF South Asia. She is now joining us on the broadcast. Sarah, welcome to the show. What do you think about the evacuation at the Al-Shifa, and in general, what's the condition of hospitals in the Gaza Strip?
Good evening, Eric, and thank you for your consistent reporting on this very important crisis. The situation, the health systems in Gaza have entirely collapsed. Hospitals are continuously under attack. Hospitals and ambulances are under attack. Patients and medical staff are being injured and killed. Access to wounded and sick is impeded by insecurity, lack of fuel, connectivity issues. Most of Gaza's hospitals are out of service. As you may know, electrical power and water have been cut off due to the lack of fuel and due to damage of healthcare facilities sustained in multiple attacks. Now, while some of the hospitals have closed, those that are functioning are doing so with extremely limited resources. We're often unable to admit new patients into these hospitals due to a lack or a complete non-existence of medical supplies. There's very limited medication. There's very limited fuel, food, and water. Things have only gone from bad to worse since October 7th. medical staff that are working in Gaza, those that work with MSF and with other organizations and are there working day in and day out, they are utterly exhausted, Eric, and they're doing what they can. These are impossible conditions to work in.
Sana, we received reports that some MSF staff and their family members came under attack. What's the status on that right now?
What is the status? So yes, a few days ago, we received information that we had a convoy, a large convoy that was attempting to evacuate. Prior to our convoy's departure, we had informed both parties of this conflict that our movement was going to take place. We were given the green light to proceed. And on November 18th, this convoy of about 130 odd people moving in 5 vehicles and on foot, we departed from our MSF premises in Gaza and we headed towards the south of the Gaza Strip. This convoy followed the exact route that was indicated by the Israeli army, along with many other civilians that were trying to leave the area. Unfortunately, this convoy was not able to pass that last checkpoint. It's in an area called Wadi Gaza, about 7 kilometers away from MSF's premises. We were not able to cross it. It was extremely overcrowded, and we had to turn back. It was on the way back that 2 of the 5 cars in this convoy all were clearly identified with clearly visible logos of MSF. That is when they were attacked on their way back. Israeli forces were also informed about both movements, both to that checkpoint and that attempt to return back. We're currently maintaining contact with the team, but yes, unfortunately, one of our staff's relative was killed. Another one was injured in this particular attack.
Sana, talking about maintaining contact, there has been a communication blockade in the Strip for quite some time now. How do your staff reach out to you, or how are you coordinating with your colleagues in Gaza?
Eric, it is very difficult. We've had limited contact with them. We lost complete contact almost with our staff that were in Al-Shifa hospital for a period of almost 3 days at a certain point. We were able to regain contact with them, but the situation there is simply harrowing. A lot of the doctors that are working in Al-Shifa hospital and the patients there, they're essentially trapped. We are aware that we've been informed that there are bodies lying right outside the premises of the hospital, that injured people who are urgently needing to get into the hospital are waiting outside the hospital. Unfortunately, the situation is so precarious. Hospitals are becoming direct targets of attack. Hospitals are being directly attacked. Medical ambulances are being directly attacked. Medical staff are being directly attacked. So the contact that we have continues to remain limited, and the situation continues to be extremely catastrophic.
All right, I've been talking to Sana Beg. She's the Director of Communications for MSF South Asia. Sana, thank you very much for talking to us today.
Thank you.
WION is now available in your country. Download the app now and get all the news on the move.